Heart failure is a serious long-term chronic condition. According to the American Heart Association, more than 6 million Americans are living with heart failure, and more than 1 million new cases are diagnosed in adults aged 55 years of age and older each year. St. Luke's Mid-America Heart Institute offers a full range of heart failure treatment options, including the full spectrum of surgical support for advanced heart failure. Our dedicated team of heart failure cardiologists are certified in advanced heart failure and transplant cardiology and are able to create a personalized care plan for each patient using a combination of medicine, surgery, symptom management strategies, and the very latest treatment and technologies. With me today is Dr. Taiyeb Khumri, a heart failure and transplantation cardiologist at St. Luke's Mid-America Heart Institute. Thank you so much for joining us.
Pleasure.
Well, to start, what is heart failure, Dr. Khumri?
So heart failure is a condition that is a clinical diagnosis. It's related to patients who have symptoms of shortness of breath or fluid retention, related to a heart condition in which the heart is either getting too weak or too stiff.
Okay. And what health risks are associated with heart failure if left untreated?
So like I said, the primary symptom related to heart failure is shortness of breath. And so that shortness of breath has significant impact on patients' quality of life, activities of daily living, work-related symptoms. And then if left untreated, unfortunately, there's a very high risk of hospitalization and death related to progressive heart failure.
Okay, so what treatment options are there for heart failure?
I think we treat heart failure in two ways. One is for symptom control, which is usually with water medicines, but then there's a wide variety of options available, medicines and advanced therapies available to improve survival. One of the things that we aim to is improve survival, which is really important, and the other is to reduce risk of hospitalization.
Okay, so St. Luke's offers a device called CardioMems to patients with heart failure who meet certain criteria. You brought this with us. Tell us about this treatment.
Yeah, so this has been available for the last almost 10 years. It's a small sensor that's implanted into the lung arteries. The idea is that when patients start retaining fluid, the pressures in the lungs start going up. And using this device, we can monitor that fluid retention ahead of time. Traditionally, we've used patients' weight and symptoms to identify worsening heart failure to reduce risk of hospitalization, though that has been quite ineffective. And using this technology, when we're able to monitor the fluid retention, we can reduce the risk of getting admitted to the hospital by about a third.
Wow, that's great. And who's eligible for CardioMems?
So there are two kinds of patients that are eligible: those who've had heart failure hospitalization within the past 12 months, or those who continue to have moderate to severe symptoms related to heart failure.
Okay, great. And how does CardioMems benefit patients with heart failure? You touched on this a little bit, but tell us more.
Like I said, again, one of the biggest morbidities related to heart failure is A, symptoms of functional limitation, and B, pretty high risk of hospitalization. As you alluded in the past, there's about 1 million hospitalizations every year related to heart failure, which significantly impacts patients. And using a device like this, which is inserted very non-invasively through a small catheter in the neck, we can get very close monitoring of the patient and reduce the risk of hospitalization, and also hopefully improve their quality of life.
Okay, fantastic. Well, is there anything else you'd like to touch on today?
I think heart failure used to be a very morbid condition in the past. In the last 20 years, there's been a lot of advances. This is one of those examples of advances. There's a lot of advances not just in preventing progression of heart disease, but in treating patients with advanced heart disease. And I think it continues to be an exciting time to be a heart failure cardiologist and practicing at St. Luke's Hospital.
Wonderful. Well, thank you so much for joining us.
My pleasure. Have a nice day.
To learn more about heart failure, visit stlukeskc.org/heart failure. You can also find updates on other health news at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.